Dr. Stein, let's talk about sleep apnea and ways on how to prevent and make that better. There are many ways out there, but what some people don't realize is that dentists have one of the a wonderful way, and even do, for certain reasons, one of the best ways to fix it. And I know you're doing some of that stuff.
Yes, we have a variety of options, whether it involves snoring devices or grinding. There are mouth guards that can be made for whether it's for children who are playing sports, which is one use of a mouth guard, or for at night for sleep. Yeah, you mentioned sleep apnea. We make appliances to help with sleep apnea, for again snoring, and people that do have heavy grinding in the night. It's very important to protect the teeth, because people can really do a number on their teeth and break down teeth, and a simple appliance just to protect the teeth, which is just something you sleep with, can really protect the teeth. We also
sorry to interrupt you. People shouldn't grind their teeth, because grinding their teeth one way or the other way puts the teeth out of alignment, and as you have mentioned in another video, that can cause muscle tensions, neck tensions, back shoulder tensions, and even headache. However, let's talk about the sleep apnea. Sleep apnea, basically, a person gets sometimes for a few seconds or a minute or whatever it may be, deprived of breathing. He doesn't breathe, right?
Right, they stop breathing for...
Stop breathing. And on a long run, over many, many years, always a few minutes, that's just unhealthy. It damages the brain, it damages all kinds of things. Tell us a little bit about that, and tell us, that, for instance, like most people who snore, not all, I suppose, or maybe all, you're the one who knows, have that kind of sleep apnea. So snoring is one unpleasant thing, maybe, but at the same time, those people, if you really watch them and look at them or even measure them, you will see that 2, 3, 5, 10 times, some of them even 2, 3, 5 times a day, an hour, and some of them 2, 3, 5 times a night, simply stop breathing for half a minute or so, which just simply is unhealthy. And you can have mouth guards which prevent that, right?
Yes, because the mouth guards can help open the airway, and so that the person will be able to not stop breathing during the night. In some cases, we have to evaluate whether that's enough of an appliance, or we may work alongside the physician sometimes they need to sleep with a monitor during the night to see how often that happens. We don't want it to be just the appliance alone, but right. As part of the overall treatment, we can certainly in many cases avoid more expensive treatment, and we want to pick up if somebody is snoring. Not every person that snores has sleep apnea, but right. many people that do have sleep apnea will also have the symptom of snoring, so we want to try to determine, is it just snoring, or do they have a problem, a more serious problem, which can lead to death, or over the time, deprivation of oxygen to the brain. So we do,
right.
We try
those people who have sleep apnea and stop, let's say, a fair amount of times breathing, which some people is 20, 30 times a night, or more often, they tend to wake up more exhausted, more tired. They slept, but they really didn't. Isn't that one of the symptoms with it?
Yes. Yeah, they will, yes.
And that couldn't be good. I mean, to wake up tired, Jesus, the day is hard enough, it's not good. Now, there's another thing. You mentioned something. You said more expensive treatment. Tell us about some of the more expensive treatments which are out there, rather than having a dentist put an appropriate mouth guard in it.
That would be, I was referring more towards medical treatment, that they may need other treatments that But if we can, in many cases, I'm not sure I'm answering your question. Is that what you're referring to?
I suppose so. Like, for instance, I know there is this, I don't know what they call it, but anyway, it gets compressed oxygen and you put a mask on it,
Yes.
Which, forces you to breathe, and that obviously is more expensive. Now,
right.
Not only is it more expensive, which is fine sometimes, it's a one-time expense, it's not the end of the world, I guess, but lots of people can't stand it. They can't sleep with it. They tear it off.
Right.
It's just too uncomfortable. You have a hose coming out. You got to sleep like a mummy, I guess, or something like that.
Right.
And it's kind of like if a person doesn't do a good treatment, which is good, to putting that oxygen mask on, then the other treatment, like putting on the mouth guards, for all purpose, immediately becomes the very best because it's the one you do. It's the one you can do. It's the one you accept. Like a long time ago, actually not so long time ago, 5-6 years ago, I asked a guy whom I knew was in exercising and he was all kinds of, an exercise expert. And I said, so what's the best exercise to do? And I expected him to say something like swimming or whatever, which we know is apparently healthy and good. And he says, Helmut, the best exercise to do is the one you will do. So
that's true.
Yeah.
Right. Yeah, the one that's can easily be done and is more bearable for the person and doesn't take a lot of effort to do. If it's good, the more effort it does, it can be. People tend not to do it. So
right.
The more
right. So people who so if people snore a lot. And if people somehow feel that they sometimes might stop breathing, or maybe they might ask their spouse, look, do you sometimes, and the spouse might go, well, yeah, come to think about it, I think you do, never paid attention to it, but I suppose we should be, because not only can it go too far one time and you wake up dead, even though I think there's very little evidence that ever happened, the point is, if you're not getting oxygen to your body regularly, slowly but surely, you kill some of the cells which have a lot to do with oxygen, mainly in the brain. And it's first visible by being somewhat tired and exhausted, like waking up like, my God, I'm already tired. And that can be handled with some trace from your butt. If that is the problem. So people should go and check it out, right?
Mm-hmm. Yes, absolutely.
Good.
Yes, it's very important.
Yeah.
It's not something to neglect, and then we have to, depending on the person, we have to see again. If we can help them with a simple device that they're more likely to use, and that's good. If they need further treatment or further evaluation, we're treating a whole person, and each person is different. So what works for one may work, but we want to try to help as many people as we can and catch things as early as possible.
Mm-hmm. Right. Okay. Well, it's again, amazing how much influence a dentist has on the overall health of a patient. It's amazing to find that all out. Bye-bye.